Hi guys, today I just want to explain about renin angiotensin aldosteron system, the renin angiotensin aldosteron system. Um, when we talk about the renin angiotensin aldosteron system, um, this is a system that tends to regulate our blood pressure, uh, our blood volume, and also the concentration of ions in the circulatory system. Now, if I have to just give you an example, like a patient just comes to you and you realize that the patient has suffered from diarrhea and which really resulted in um, have blood volume to be very low, and also she has um, low blood pressure. Now, you as a doctor, what are the measures that you can do in order to help this patient? The renin angiotensin aldosterone system, if you actually know the system, then you can be able to issue the proper or the appropriate drugs for the patient. Like, you don't expect to give um, drugs that are going to further lower the blood pressure of the patient. But if the patient is having high blood pressure, obviously the drugs that you need to issue to that patient would be the opposite. So understanding the renin angiotensin aldosterone system is very important with regards to the kind of drugs that we give the patient, like the beta blockers, like the ACE inhibitors. We're going to talk about that later, do not worry. So how does this system work? Now, the aim of renin angiotensin aldosterone system is basically to increase our blood volume. And by increasing the blood volume, obviously, we're going to increase the blood pressure. Okay? So when the blood volume increases, the blood pressure increases. That's the function of the renin angiotensin aldosterone system. But how does this system work? Now, what you have to understand, like basically, you have a lot of organs that are playing part in this event. You have the kidney will be taking actions. You have the liver. You have even the hypophysis, which we call the pituitary gland. You have so many other organs like the adrenal gland. All these are organs that are going to play part in the renin angiotensin aldosterone system. Don't worry, we're going to explain about the renin angiotensin aldosterone system. But what I just want you to know as of now, it is a system that is, mechanized to bring up or to raise the blood pressure. It can also raise the level of sodium, in the blood. So because we know that wherever sodium goes, that's where water follows. So increasing the uptake, that is the reabsorption of sodium from the renal tubule, will actually increase the the level of fluid like water into the circulation. So let me just repeat myself. The organs that are going to the most important organs that are going to take part in the renin angiotensin aldosterone system. We're going to explain the topic in detail. One, you have the kidney. Two, you have the liver. Three, you have the lungs. Four, you have the adrenal gland. Five, you have the hypophysis. These are one of the most important, like they are the most important. Okay, you may have other organs that may play part, but knowing these organs will help us to explain the topic very well. Now, if we have to explain the structure of the kidney, now the kidney is the one that is playing the most important role in this renin angiotensin aldosterone system. because in the kidneys, you all know that what takes blood, the arteriole that we call it, that takes blood to the glomerulus. I believe you know what is the glomerulus of the kidney, is what we call the afferent arteriole, or in Latin we call it arteriola glomerularis afferent. So within that afferent blood vessel, or that we call the arteriole, there are specialized cells in them, and these specialized cells are called the juxtaglomerular cells. I repeat myself, in the afferent arteriole we have specialized cells. Those specialized cells are called the juxtaglomerular cells. And what is the function of these juxtaglomerular cells? The juxtaglomerular cells are responsible to secrete renin. We'll talk about this renin. Okay, renin is an enzyme. For now, let us just understand that the afferent arteriole that takes blood to the glomerulus for filtration to occur, it has specialized cells called the juxtaglomerular cells. These juxtaglomerular cells, they secrete what we call renin. Okay, now the other important structure that we need to talk about in the kidney is going to be what we call the macula densa. These macula densa, they are also specialized cells that are located in the distal tubule. I believe you know what is the distal tubule. Okay, you need to know the anatomy of that. Okay, now what is the function of these macula densa in the distal tubule? Now, in the distal tubule, the macula densa is responsible, to detect the concentration of ions in the distal tubule. Which ions? The sodium and the chlorine. So, if the concentration of sodium and chlorine are very low, macula densa will be stimulated because they can be able to detect, the concentration of sodium and chlorine in the distal tubule. Okay. The other thing that you need to know about the structure of the kidney regarding the renin angiotensin aldosteron system, it will be what we call the extramesangial cells. Now, extramesangial cells, basically what they are responsible of doing is, like, they are able to create contraction of the arterioles that I've just mentioned, in trying to regulate, the flow of the blood into the glomerulus. So these three that I have just mentioned, the juxtaglomerular cells that secrete the renin, we have the extramesangial cells responsible for contraction of the arterioles. Okay, we have the macula densa responsible for detecting low level of sodium and chlorine. These three is what we call the juxtaglomerular apparatus, or some will call it the juxtaglomerular complex. Okay, so what are the structures that give rise to the juxtaglomerular apparatus? We have the macula densa, we have the juxtaglomerular cells that secrete renin, and we have the extramesangial cells. Remember, we also have intramesangial cells, but they are not part of the juxtaglomerular apparatus. Okay, so okay, now we continue. So we have already listed the most important architecture or structure of the kidneys that will help us to understand about the renin angiotensin aldosteron system. Okay, now we have to talk about the liver. Now the liver, it is an organ that is responsible for secreting a product called angiotensinogen. Okay, the liver is responsible for secreting angiotensinogen, and this angiotensinogen is what will be first used regarding this renin angiotensin aldosteron system, but the mechanism will be explained later. Okay, now when we talk about the lungs, the lungs is going to secrete an enzyme called what we call the angiotensin converting enzyme. Okay, the angiotensin converting enzyme is going to be secreted by the lungs, so it's very important for us to know that. Okay, now this angiotensin converting enzyme, if you ask me, is it the lungs that only secrete it? No, that's not the case. But the most important organ that secretes what we call the angiotensin converting enzyme is the lungs. Okay, now if we talk about then what is the importance of the adrenal gland that you have just mentioned previously. Okay, now we all know that the adrenal gland, okay, or some will call it the suprarenal gland, it has basically anatomically we divide it into two structures. We have the cortex and then the medulla. The cortex is further divided into three. We have the zona glomerulosa, you have the zona fasciculata, then we have the zona reticularis, but those are not important. What you have to understand, the most important thing regarding this renin angiotensin aldosteron system here is the cortex portion of the adrenal gland, which we call the one of the portion of the adrenal gland is the zona glomerulosa. And the function of this zona glomerulosa is to synthesize and release aldosterone. Okay, is to synthesize and release aldosterone. It's very important for us to know that. Okay, now I've already just given a summary about that. Then what about the pituitary gland that I have just mentioned? If we have to talk about the pituitary gland, or some will call the hypophysis. Now, the hypophysis, it has two lobes. You have the anterior lobe and the posterior lobe. We are concerned about the posterior lobe because that is what has connection with the renin angiotensin aldosteron system. The posterior lobe is able to synthesize, it's not able to synthesize, let me make myself very clear, it is just like a storage. Okay, it is just a storage for basically two hormones, which are the oxytocin and you have the antidiuretic hormone. The oxytocin is not important for us today, but we have the antidiuretic hormone, or we call it ADH. You must have known about that, or the other name for it is what we call the vasopressin. These are very important things that we need to know about the renin angiotensin aldosteron system. Now, if we have to resume and start explaining about the mechanism of renin angiotensin aldosteron system, if you could recall, I said that the renin angiotensin aldosteron system basically works to increase the blood pressure, the blood volume, and also to increase the uptake of ions like sodium and chlorine. Okay, under which condition is the renin angiotensin aldosteron stimulated? When the blood pressure is low, when the blood volume is low, when the concentration of sodium and chlorine is very low in the renal tubules. How does the system work? Now is what I'm going to explain. We have what we call the macula densa, if you could recall, that is a specialized cell. This a group of cells in the distal tubules that are able to detect low concentration of sodium and chlorine. Now, what happens if they detect low concentration of sodium and chlorine in the filtrate? that pass through. What they're going to do is they are going to stimulate the juxtaglomerular cells. And we know what are the juxtaglomerular cells responsible of. The juxtaglomerular cells are going to release what we call renin. Now, the renin that is released is going to get into the circulation. It will go to the liver. Now, when renin gets into the liver, the already synthesized angiotensinogen in the liver is going to be cleaved proteolytically by the renin. So it's like renin serves as an enzyme. So renin is going to proteolytically cleave. It means it's going to cut certain amino acids from angiotensinogen. So if renin cleaves those amino acids from angiotensinogen, the angiotensinogen is now going to be converted to a form called angiotensin I. Okay? Renin gets into the liver, and when it gets into the liver, or the already synthesized, let's just make it this way, the already synthesized angiotensinogen from the liver is going to be cleaved by renin. Okay? So if it is cleaved by renin in the circulation, what happens? Angiotensinogen is going to be converted to angiotensin I. Okay? Now, what happens? This angiotensin I is not functional just like the angiotensinogen. Okay? So the angiotensin I is going to travel, of course, through the blood system. It is going to go to the lungs. And when it gets into the lungs, the angiotensin I is going to be converted to angiotensin II by an enzyme called angiotensin converting enzyme. Okay? By an enzyme called angiotensin converting enzyme. So, which means angiotensin converting enzyme is going to convert angiotensin I to angiotensin II. Now, when angiotensin II is produced, this angiotensin II is the functionally, and it is the active form of angiotensins that we have already mentioned, is the angiotensin II. And the angiotensin II is capable of going to all those organs that we have just mentioned previously. It is capable of going to the hypophysis, gland, which we call the pituitary gland. The angiotensin II is able to go to the suprarenal gland, or we call it the adrenal gland, because it has receptors in those organs. Okay, it is also able to go to the kidneys to exert an effective function. So the function of angiotensin II is very, very important in trying to make the system of renin angiotensin aldosteron system work. Okay, now if the angiotensinogen is converted to angiotensin I, and angiotensin I is converted to angiotensin II, and we say that the angiotensin II is the functionally active form of all these angiotensin that we have mentioned. The angiotensin II, what it does is it will go to the hypophysis. When it goes to the hypophysis, the posterior lobe, where those hormones are being stored, it is going to stimulate the release of antidiuretic hormone, or what we call the ADH hormone. Okay, this ADH, antidiuretic hormone. So angiotensin II, by binding to the receptors that are in the posterior hypophysis, is going to cause the release of antidiuretic hormone. So the release of that antidiuretic hormone, what is going to do? The antidiuretic hormone is going to travel to the kidneys. Which portion of the kidneys? Especially um, the collecting tubules. Is going to the collecting tubules, and when it gets into the collecting tubule, what does it do? It stimulates the synthesis of what we call aquaporins. Okay, so these aquaporins, they are just going to be fixed on the cells of the, the, the collecting tubule, so that water can be absorbed. But before water is going to be absorbed, obviously sodium is going to be absorbed. That's what we have to understand. Okay, then how is sodium absorbed? That is what I have to explain. It's the same angiotensinogen, angiotensin II. That angiotensin II, what it does is it is going to get into the suprarenal gland, or what we call the adrenal gland. If it gets into the adrenal gland, what in the cortex portion of the adrenal gland, which one of it, which we call the zona glomerulosa, what it does there, it causes the synthesis and the release of aldosterone. So what the aldosterone is going to do is, aldosterone is going to get into the kidney. When it gets into the kidneys, it is going to stimulate the what? The uptake of sodium. Okay, it's going to cause the uptake or the absorption of the sodium. Okay, so which means sodium is now going to be absorbed from the filtrate to the cells. So when sodium is absorbed, obviously, like I mentioned, wherever sodium goes, that's where water follows. So it means that's how water also is going to be absorbed through the aquaporins into the cells, and from the cells get into the plasma. Okay, so when it gets into the plasma, what is going to happen? Which means both sodium and water gets into the plasma, the blood volume will increase, and as the blood volume increases, blood pressure also is going to increase. Okay, so basically this is how the system works. Okay, now just to summarize everything here is the renin angiotensin aldosteron system. It works by the effective function of several organs like the kidneys, organs like the liver, organs like the lungs, organs like the suprarenal gland. And all of these organs have their specific functions. How does it start? The mechanism: at the level of the distal tube, we have the macula densa cells. These macula densa cells are going to detect low concentration of sodium and chlorine, and they are going to stimulate what? Juxtaglomerular cells to release what we call renin. Renin gets into the circulation, and what it does is going to cause the cleavage of angiotensinogen that has been produced by the liver. So when renin cleaves angiotensinogen, the angiotensinogen is going to be converted to angiotensin I. The angiotensin I is still an active form and cannot be able to do anything, so it has to be cleaved again proteolytically by an enzyme called angiotensin converting enzyme that is mostly synthesized by the lungs. So when angiotensin I is cleaved by angiotensin converting enzyme, it is converted to a form called angiotensin II. So angiotensin II is able to do a lot of functions. One, it is going to get into the kidneys. It is going to get into the suprarenal gland. When it gets to the suprarenal gland, it is going to cause the synthesis of aldosterone and the release of that aldosterone. So the releasing of that aldosterone is going to cause the stimulation of sodium reuptake or sodium absorption from the renal tubules. Okay, also the angiotensin II, what it does is it can go into the posterior hypophysis that we call the pituitary gland. So what it does there is the the release of antidiuretic hormone. So what the antidiuretic hormone does is going to cause the, the, the absorption of water from the filtrate. So both water and sodium, when absorbed and they get into the plasma, that's how the blood pressure is going to increase. So, and that's how we're going to regulate um, low blood pressure. So initially the case was the patient blood pressure was low. So through this mechanism, the blood pressure was able to increase. So it means the system naturally can be able to, regulate the blood pressure in any system or in any period of time. But what if the system doesn't work perfectly? Now, let's say this renin angiotensin aldosteron system works very high. So if it works too much, it means it's also not good for the body, because the homeostasis of the body is going to be disrupted, and that is why we have drugs for them in order to lower the blood pressure when the blood pressure of the patient is always high. Like we give the patient what we call drugs like the spironolactone. Okay, we can give the patient drugs that can stimulate the release of anti-natriuretic peptide from the heart, that can also be able to lower the blood pressure. We can be able to give the patient what we call the ACE inhibitors. So you know what are the ACE inhibitors? That is angiotensin converting enzyme inhibitor, because we know the function of that angiotensin converting enzyme that is able to what? Convert angiotensin I to angiotensin II. So which means if at all we inhibit that pathway, we will the effective function of angiotensin II will be compromised, and angiotensin II will not be able to increase the blood pressure. Okay, so these are basically the drugs that we give to patients with high blood pressure. The beta blockers, you have the ACE inhibitors, the calcium channel blockers. Okay, and thank you very much for listening.